press conference being facilitated by the Ministry of Health. It's basically an end-of-year update. We're happy to have you if you're joining us via the Channel 22 or Facebook and YouTube pages, and of course our colleagues via Zoom, and those of you in the diaspora. So we have here with us the Honorable Minister for Health, Nicholas Steele. He's closest to me, and next to him is the Chief Medical Officer, Dr. Sean Charles. Without any further ado, I'll hand you over to the Honorable Minister. Good afternoon.
I want to first and foremost take this opportunity to recognize and thank all of our team members at the Ministry of Health and our other stakeholders, RGPF, for amazing work done for the very trying year of 2020 that we have had. And to the people of Grenada as well for their patience, their understanding and their tolerance in this trying year. But the team in particular that have been conducting the tests, that have been conducting the swabbing, that have been doing the contact tracing, that have been at the lab testing, all of these individuals who continue to provide human service in what started earlier this year and has continued all the way through, including on Christmas Day, Boxing Day, when the rest of us were at home with family members. They were still out in the field performing for us. So I want to recognize them as well. Having said that, I want to turn you over to our Chief Medical Officer, who will give you an update on the epidemiological situation at present and a synopsis of the year with respect to total tests, etc., done to date. Thank you.
First, let me say a warm good afternoon to the Grenadian family, and I too would like to recognize the work that was put in by the team at the Ministry of Health and all our other frontline partners in assisting us to get through such a challenging year. As we close, we would like to recognize all of these individuals and to say thank you to them for putting in the hard work to ensure that the majority of us can have a chance of having a relatively safe and healthy life and a safe and a healthy existence as we go about our daily lives in Grenada. Now, permit me to just summarize the situation as it relates to the greatest public health challenge that we have had to face and that many countries are facing at present, which is the COVID pandemic. Permit me to just summarize where we are at this moment. To date, we have identified a total of 126 cases, COVID-19 positive cases in Grenada. Of those, I am happy to report that we have 16 active cases. And this is down from, I believe, around 50 just a few days ago. The hardworking team on the front line deserves to be recognized for the tremendous amount of work that they put in to get us towards at this stage. But in particular, permit me to summarize the events as it relates to the recent cluster of cases that we have had to face, because this cluster had resulted or had placed some acute stresses on the system, which we've had to rise to meet. So, following the identification of a case, a COVID positive case at an accommodation in the south of the island, public health authorities immediately commenced intensive investigation, case identification, and public health measures to halt the progression of this cluster, of this outbreak. The initial round of testing yielded 16 positive cases. This included 15 individuals employed by the accommodation and one affiliate that operates on the compound of this property. In addition, 9 guests were found to be positive. Like I said, we immediately initiated aggressive public health measures to get this situation under control. It involved the quarantining of all of the workers of this facility, doing follow-up testing, contact tracing and follow-up testing of their families, their close contacts, and so on. Now, when we go about doing these investigations, what we must understand, COVID-19 is an acute infectious disease. The incubation period is 2 to 14 days. The initial round of testing, the purpose of the initial round of testing was to detect the individuals that were infected at the time and that would have been a danger to the public. So we had to immediately identify those individuals, get them into isolation, test all their contacts. Now, we do not just test the contacts immediately because it takes, like I said, the incubation period is 2 to 14 days. If you test someone too soon after exposure, you run the risk of getting a false negative, even if that individual was infected. This is the reason why we do 2 rounds of testing. The initial round of testing was to identify individuals who were already infected and to immediately take public health steps to halt the progression of the outbreak. These individuals were placed in quarantine, the positive cases were isolated, and contacts of the positive cases were tested. A second round of testing was conducted some 10 days later. The purpose of this was to identify individuals who might have been infected and did not show up early. Also, to test positive individuals to monitor the clearance of the virus. All right? Because those individuals who are positive, it is an acute infectious disease. Within 2 weeks or so, the majority of individuals will clear the infection. Now, following the second round of testing, which occurred some 10 days later, on the 23rd, and some on the 24th of December, 14 of the positives had recovered from the infection, and they were granted public health clearance. 2 individuals continued to be positive, one of which had to be treated for pneumonia as a result of the infection. a third round of testing was done on these individuals before public health clearance was done. Because you would remember that prior, at the initial phases of this infection, to clear someone, you required 2 negative tests within at least 24 hours apart. That is no longer the accepted standard, but we still require at least 1 negative test to grant someone clearance. Well, what about the contacts? Because this is something that is ongoing. As a result of testing among direct contacts of the employees who are involved in this cluster, 30 individuals were diagnosed. All right, 30 individuals tested positive for COVID-19. These included, in particular, direct family contact of employees who tested positive for COVID-19. All right, in the great majority of cases, it was family contacts of employees of the accommodation property who tested positive for COVID-19. Of these 30 persons who tested positive, there are 9 cases that are still active and that are still being monitored by the Ministry of Health. This is ongoing. Every time we identified a positive case, we now have to find the contacts of that case and institute the same public health measures. We quarantine, we test, we do an early test, and we do a late test to identify either infected at an early stage or at a later stage. All right, before they are granted public health clearance. So this, in a nutshell, is what the facts are. The raw facts. And all we can present to the public is the facts. Like I say, this is an ongoing situation. Until all of the remaining active cases have recovered and their contacts have been tested and we can verify that they have not been infected, this will continue to be an ongoing process. And this is what we would like the public to understand. Thank you.
Thank you, Dr. Sean Charles, and thank you to the Honorable Minister Nicholas Steele. You want to add something? Go right ahead.
Let me just add to that from what Dr. Charles has said. I again want to recognize the laboratory technicians who have been working and want to specify and reiterate that the RT-PCR testing that we do in Grenada is not questioned. It is confirmed not just by our general hospital, but also St. George's University that has an independent lab as well. Samples from this cluster outbreak were sent to our general hospital for verification lab and was sent to SGU lab independently, and samples were sent to CARPHA, a regional authority, as well for confirmation. So at no time ever in this has, as Dr. Charles has said, and I want to reiterate, has the accuracy of the tests been brought into question. We continue to follow the protocols of working independently or collectively with St. George's University and our lab at General Hospital, as well as with CARPHA. We do this every time we have positives, and we do this as well on a regular basis with negative test results for further verification. It is part of the protocols that we have been following since we started testing here in Grenada.
Thank you, Minister. Colleagues, so you've heard from the Honorable Minister as well as the Chief Medical Officer, Dr. Sean Charles. The floor is now opened for questions. Please identify yourselves. Anybody ready with their questions as yet, colleagues?
Hello.
Hi, good afternoon. Go right ahead.
Yeah, this is Linda Straker. Either Dr. Sean or Minister Steele, are you in a position to give a breakdown of the 126 cases with regard to sex, male versus female, the age range, as well as from the number of tests that has been conducted from the start? What is the approximate cost government has to spend for those tests?
But Dr. Charles, you have the total number of tests that we've done since the outbreak, as well as the total number of tests for this cluster outbreak. So if you can share that first, and then Linda, by extrapolation or so, you can see the test costs are close to 400 EC dollars per test. So by simple multiplication in terms of the costs involved in this.
With regards to the total number of PCR tests, as of yesterday, that stands at 16,058. Now, with regards to a breakdown by sex, I would have to provide you with that information after, because I simply did not work with it for the 126 cases that we have identified.
In terms of the cluster too, how many tests have been done?
In terms of the cluster, we have done just over 3,000 RT-PCR tests. 3,092 to be more accurate.
Yeah, and Linda, just to add to that, this is why we are able to still confirm, because of 3,000 tests being done to date, that this originated at that facility.
If I just have a follow-up. Today, overnight we would have received a release from the cluster where the cluster would have been based. And one of the sentences in it speaks about PCR versus antigen, and it indicates that there were no virus in the body. Can Dr. Sean explain to us what is the difference between antigen test versus PCR test, and what kind of test is required to determine whether or not the virus was ever in any human body?
So there are differences between the tests. The gold standard test is the RT-PCR test, and that is the one that we currently do at our lab. All right, that is the RT-PCR test. The RT-PCR test identifies nucleic acid of the virus. All right, the nucleic acids are present. The viruses have to be there for their nucleic acids to be present. There are other tests, such as antigen tests, that identify some proteins that are produced as a result of infection. They are not as sensitive as the RT-PCR test, but they are accepted. There are many countries that have emergency use authorization for these tests. So this is basically the difference. All right, the RT-PCR test, which is the test that we currently conduct at our lab, is the recognized gold standard test for the identification of cases of COVID-19.
And Dr. Charles, if you can add with respect to the antigen, where and how it may show up and may not show up even though somebody is positive.
Yeah, so in particular with regards to the antigen, there is a small window, 1 to 5 days following infection, when the antigen tests can be very beneficial in identifying persons who are infected. After this, it becomes difficult, and in asymptomatic persons, when you cannot really identify when that infection took place, it's its usefulness is a little less.
Linda, any other questions from you?
Just for clarity, so Dr. Sean, based on what you would have said there, is there any test that can be done to determine if any person would have had the virus in their body at any time? Because the impression that was given from that release is that these people seem to have never had the virus in their body at any time, but yet for all they were tested positive. So is there any test that can be conducted to prove whether or not a person would have had the virus in their body at any time?
All right. So after someone is infected, some weeks after, their bodies produce antibodies to fight the infection. All right. The duration, how long after this immunity lasts is still the subject of investigation, but persons can do antibody tests afterwards to see if they were exposed to the virus.
Yeah, Linda, if I can add, because you're referring to a press release and they named themselves in the press release, so in order for us to discuss it openly, I think it is, let us say it is the Sandals press release that they put out overnight. And I want to categorically state that no hotel, no matter how large or small, is an authority on testing, nor should they be making comments. It's unfortunate. Should they be making comments on the accuracy of Grenada Ministry of Health, CARPHA, Pan American Health, or St. George's University's ability to accurately test. And I have read that release as well, and I see no reference and no information given to the authority from which they speak, which public health authority they now have or have acquired in order to make such public statements. So I would say that those statements are unfortunate. We have worked with the employees and local team here of Sandals and look forward to continuing to work with them to get to the end of this. And I think the one way that this can be accomplished is by making sure that we deal with the facts, we deal with the situation at hand, and we not try to discredit each other. We will maintain our policy here of dealing with the virus, the outbreak, and those affected by the accurate testing of them. And we expect all involved to also do the same.
Thank you, Minister. Kerlistra, good afternoon.
Good afternoon. Have any decisions been made one way or the other regarding the hospitality corridor? I know that the minister said previously that this was being put under consideration. So anything happening there, whether it's in change in protocols or an outright decision on whether it continues or not? And my second question, have there been any recent instances where persons were medically cleared by the Ministry of Health and then contacted and informed that they should quarantine because of a different set of results, that they would have been out in the community believing they were negative and not so? Any instances of that? And my third question, there's been a backlog of testing. A lot of people have been in the hotels and so for way beyond the 7-day period in terms of getting their test results. People have been unable to get through to the COVID hotline, and numerous complaints of that. Can we see a change in, is the ministry making any efforts to get control of the testing and the quarantine situation, given that we were extremely pressed because of the cluster situation? Those are my three questions.
Okay, thank you, On your first question, there has been constant, since the outbreak was first identified globally. There's been constant adjustment by the Ministry of Health here in Grenada. Most recently, prior to this, we changed the pre-travel test requirement from 7 days to 72 hours. Prior to that, we had no pre-travel test requirement. As a result of this, yes, it is obvious that we had to and have investigated fully the protocols that existed prior to the first week of December. What has been implemented immediately is that all persons traveling into Grenada will be tested on day 4. All persons must remain in quarantine until they are cleared after day 4. Previously in the corridor, individuals who did not wish to enter the rest of Grenadian community could have stayed there in corridor hotels and allowed to leave at the end of their stay just straight to travel out of Grenada. That is no longer the case. There has been complete acceptance by all of the industry here on that as we move forward. Recently also, we announced travel restrictions with respect to individuals coming from the UK, so that as well, that this is a constantly evolving situation, and we react as quickly as possible based on the information that we have, as well as Pan American Health, CARPHA, and WHO on that. With respect to information out there of individuals who would have been cleared from quarantine, that is, individuals who would have received a negative PCR test result after their 4th day swab or test. Yes, there are individuals who tested negative, were released, and then there are individuals who tested positive. And in our questioning of those individuals who tested positive in quarantine, they would have told us that they traveled with a group that came down, 2 or 3 or 4 other family members, different last names, etc., and in some cases may even have stayed at a different quarantine facility. But that they would have gone, let's say in this instance, travel from New York, would have gone to the airport together, would have congregated together in traveling to Grenada because their family members coming down, for instance, maybe for a funeral or to visit others. It is in that instance that individuals would have been contacted to say, we have information now that you have been in contact with a positive case, whom you traveled with, or who is family that you traveled with or so, and therefore we would like you to isolate until further notice, in the same way that we would have communicated to any other individual in the community who may have come in contact with a positive case, in questioning of a positive case, that we inform their contacts that they are possibly at risk of infection and therefore they should isolate. So it's in those instances that individuals would have been cleared out of quarantine, and then their counterparts who traveled with them would have tested positive, and we would have had to have communicated to them after giving them their results to say, you need to isolate, you need to take additional precautions because you were in contact with a positive case. With respect to the backlog as of this morning has been cleared. Actually, as of Monday, the backlog has been cleared. As Dr. Charles has said, on top of the normal clearing of individuals in quarantine, the Ministry of Health, the team, the frontline team, performed 3,000 additional tests in a 10 to 14-day period. 3,000, so double the amount. The majority of those tests were done in the 2 or 3 days of Christmas, between the 23rd to the 25th of December. So yes, that did create a backlog. I want to thank individuals for their patience. We understood then their frustration, and that is why the team worked diligently to clear them as quickly as possible. They are testing now at the lab again for samples that were collected as of yesterday and this morning, and expect to release those results today. So there is no backlog at present. With respect to individuals who would have been calling in, again, by mere virtue of the numbers, and also, rightfully so, a significant number of individuals in our society were also concerned as to whether they were in contact with contacts who as yet were cleared or not cleared. So they were calling in as well. That caused the inundation, or that created an issue with respect to us being able to respond. Dr. Charles, myself, all of the team were there receiving calls, as well as others who volunteered to assist in dealing with that. The backlog has been cleared now, and we look forward to carrying on under this COVID norm going forward.
Thank you, Minister. Kellon Bud? Right, okay, I thought you had three
Kellon, do you
questions.
mind if I just go with a follow-up, if it's okay with Leslie Ann?
Okay, let's just give somebody else a chance.
Minister
We'll come back
of
to you,
Health-
Kalistra. We'll come back to you.
I promise you we'll come back to you, Kalisha.
We'll come back to you. We'll come back to you. Kellon, good afternoon.
They said they will come back to you. So let me get
Okay, go ahead, Kellon.
quickly. Minister, good afternoon to you. Now, in your last press conference, you suggested that the Sandals breach, let us call it for what it is. It's Sandals. It is not a particular hotel in the South. It's Sandals, right? Now, Sandals disputed your government's claim that the cluster occurred from their facility. Now, in the last press conference, you indicated that your government will be conducting an investigation to determine what happened there. So my question to you as a follow-up today is, what is the status of this investigation? Have you gotten the ball rolling on this? And who are the parties that will be involved in this investigation? And has this matter been referred to the Office of the Attorney General for any legal action? So that's the first question, because I believe Grenadians would want some follow-up there. Now, with respect to, there was an allegation that Sandals, I know that they indicated that they were going to be evacuating guests as per an arrangement that the government of Grenada put in place with them to manage this situation. Now, there is an allegation that Sandals evacuated guests who were COVID positive. Can you confirm or deny that this in fact happened? And would there be any accounting to ensure that that does not happen in the future? And my final question, and this is for Mr. Charles. Now, Mr. Charles, you indicated that a lot of the persons who tested positive are now medically cleared. Some of them are medically cleared, which brings our COVID test down to 4. You said we have 16 active cases now. So how do the negative test results so soon after a positive test lines up with what CARPHA has been seeing in other Caribbean islands, where individuals tend to take longer than 14 days to be cleared medically from the virus, right? There have been cases where, you know, people have seen that the virus still continues to be present in the body. So I just want to get a sense of the methodology here to ensure that we are verifying that those negative clearances are in fact negative. So that's it. If there is a second round of questioning, I will be following up on your responses.
Yeah, thank you for your questions. Let me say, based on the information, the facts that Dr. Charles has just presented, and forgive Dr. Charles, he is a professional, and in his professional communication, he uses the terms as prescribed by WHO and Pan American Health Organization and refers to an institution. But yes, in all of the facts still point, in terms of the number of tests we've done, in terms of the number of positive cases that we have identified, in terms of work-related, there for all of these positive cases that have that connection, that it points to a breach at Sandals. Now, we have already started, as I said, from day one, our investigation. We have already made certain changes within the entire hospitality corridor here in Grenada. As a result of that, the continued investigation as to whether there is any criminal intent here or not, that is, when we provide the evidence as Ministry of Health, that is independent and a decision of the Director of Public Prosecution and the Attorney General. Our job is to provide all of the facts there. Now, in terms of individuals, any individual traveling who is positive, remember, Grenada, unlike many other countries, insists that someone receive a PCR test, negative PCR test, before they board an aircraft to travel to Grenada. There are countries, and therefore, at check-in at airline counters here where persons are traveling to those countries, there is not a request for a negative test result in order to ensure that a person boards, and that is a risk that we are not comfortable with, but it is a risk we need to recognize. If you are traveling to countries that do not require a pre-travel negative test, you run the risk of being on an aircraft with individuals who may be positive and not even know themselves that they are positive. Based on information that was released to us from Sandals, is that these individuals left, those who were positive, left within days of the initial investigation or outbreak. There was no official communication to us that these individuals were going to be leaving. We did request that they get all of their guests off island as quickly as possible so that we could minimize any further spread and that we could get control of the situation, that their very own employees as well could be placed in isolation and not have that continued interaction or so and working. They were compliant with that, but we did not receive communication from them on particular guests wanting to leave or having a schedule to leave. They, as far as we're concerned, were following our instructions to get their guests off island as quickly and as conveniently as possible. So yes, they as to whether there is a law in Grenada that says a person cannot board an aircraft knowing that they're positive, no, there is not, as far as I'm aware, subject to correction from the Attorney General. There is regulation with respect to persons who are placed in quarantine by the CMO and breach that quarantine in an effort to head to the airport and leave. So that, again, is up to the DPP and the Attorney General based on the facts that are presented that we are all very much aware of to date.
So, with regards to the perception that individuals were testing negative soon after they test positive, you must understand the disease, the dynamics of the infection. When you conduct a PCR test and you identify someone who is positive, it means that at least 4 days before that, all right, at least 4 days before that, up to 14 days prior, that individual was exposed to someone and got infected. Because it generally takes about 4 days or so before there is sufficient viral particles to be measured in the specimen. So at the point where we identified those individuals who were positive, they were already infected many days before. That is the reason why we were able to identify them. And by instituting the quarantine and isolation of those who tested positive, the aim was to ensure that they don't go on to infect others. So when we put in those measures and the workers could no longer congregate at the place of employment, what in essence we did was to ensure that there is no ongoing spread at the property. Now, the second thing I mentioned is that we tested 10 days after the initial round of testing, and I tried to explain that as clearly as possible. The second round of testing was conducted 10 days later. By that time, these individuals had a very good chance of clearing the virus because, as we are aware, the employees are young adults. These individuals generally tend to have no symptoms or mild, if any. These individuals are able to clear the infection at a faster rate as opposed to someone maybe over 65 or someone with underlying health conditions. Now, of course, we did have 2 individuals that it took a longer period of time for them to clear the infection. And it was only yesterday that they were cleared. So that perception out there that they cleared a day, it is a false perception that should not be continued. Thank you.
Thank you. We have a question from MTV. They're asking for an update or any new developments that can be provided with regard to the COVID-19 vaccine.
So, the Ministry of Health has been making preparations with regards to the introduction of a vaccine, because we do realize that we will need a vaccine to ensure that we limit the risk to our population. All right, so we have started the process by engaging with the COVAX facility. We have also done the request for the vaccine. We've also started meeting to develop the plan for the deployment of these vaccines, examining what challenges there may be, and examining the resources that we have. All right. We are hopeful that a vaccine would be accessible to us in the near future, and we will rely on the immunization program that has existed for decades and that has assisted in Grenada eliminating conditions such as measles and rubella and whooping cough and all of these. We would rely on this same system to deploy these vaccines to ensure that our population is protected.
I think to add to that, the question isn't the use of a vaccine. The question, which we will update you consistently as soon as next week as well, is the procurement and timing of a vaccine and which vaccine. We are seeing in international news many countries making unilateral decisions based on their capacities, their capacity for manufacturing, their capacity for testing themselves, their capacity for evaluation themselves, their national capacity. And they're making what is referred to as emergency authorization for the use of, which basically means that they are not waiting on WHO or Pan American Health Organization to certify or approve a particular vaccine, but they are making national decisions themselves. Now that is within their own right, and they have the capacities to do that. Among the CARICOM countries, we have recognized that we do not have the capacity to do that. So we have said that we would wait for Pan American Health Organization through the COVAX facility to recognize, identify, and to assist in the procurement of the appropriate vaccination to be used. Many of the vaccinations that we are seeing being used now are quite successful in their implementation and their efficacy against COVID-19. What we have to consider is, in the best interest of our own population, is to recognize that there are certain national authorities, for instance, the CDC of the USA, Public Health Canada of Canada, the NHS of the UK, the European Center for Disease Control, that we rely on for up-to-date, accurate information, and they have themselves approved certain vaccines already. And on top of that, that it is through their approval, they are the members, like us, of WHO. It is based on their approval that WHO then approves a series of vaccines. So quite possibly, I think what we need to contemplate is relying on some of these national authorities that we have respected throughout, even before COVID, and to fast track the procurement of one of these vaccines that has been approved by many of these respected national authorities in order to get it here in a timely manner. Until we have a significant amount of vaccinations here done locally, we are going to keep going in this cycle, like many other countries are, with respect to cluster outbreaks, or always the risk of community spread and having to adjust and continue this level of economic and personal discomfort. I was just informed, actually before news time, that Barbados themselves are now going under curfew because they now have a possible outbreak, details of which, and I will share, or we will share with you, and I'm sure we can all monitor what's happening with our brothers and sisters in Barbados as well, in the same way that they monitor what's happening with us. But that is the comment with respect to vaccination at this point in time.
Thank you, Minister. So somebody just asked the question, well, actually GBN, and coincidentally I was just handed the a release on that.
I'm having trouble hearing.
Okay, so GBN is asking, has permission been revoked for the fireworks display that should take place tonight? So let me just quickly read this as it has been handed to me. Further to a press release issued on December 30th, the government of Grenada now advises that permission granted to designated facilities for fireworks displays on All Year's Night has been rescinded. Therefore, there will be no fireworks displays at any location in the country. Let me repeat that. There will be no fireworks displays at any location in the country. All individuals or business entities are therefore asked to be guided accordingly. Government apologizes for any confusion created by the previous release, but it encourages the cooperation of everyone. Failure to comply could result in legal consequences for breaching the current regulations. So that is an answer to your question. So Linda Stricker, you have another question?
Yes, thank you, Len.
Right, yeah, definitely.
My question has to really do with quarantine. Now, over the past couple of weeks, we would have learned and know that the cluster would have overwhelmed the system. But what structures are now in place if something like that was to be repeated? Secondly, the accommodation, as a result of that quarantine and the overwhelming of the system, there are persons who would have stayed in quarantine for as much as 10 days, and some of them would have booked for 7 days. Is government or the Ministry of Health reconsidering putting Grenada's quarantine period to flat out 14? And if you get out before, you're cleared before, then that's another story with you and your hotel. Is that under consideration? My third question is, given the drastic reduction in the amount of active case we have now, with that has caused the delay in the reopening of school, will that school reopening now be reconsidered to a date sooner than we would have that would have been indicated to us in terms of the new structure? And my final question is, with regard to the vaccine, at the last PAHO news conference 2 weeks ago, one of the things that was said to us was a call for governments in the region to make preparation for the rollout in terms of prioritizing who get first as to who within that bracket would actually get first. Has Grenada already decided on the priority list, and who are the priorities in that priority list?
Thank you, Linda. With respect to, your comment of the system being overwhelmed, I definitely agree that the system was tested to the max in dealing with the 3,000 tests, as well as dealing with those who were clearing quarantine. Now, if such a occurrence were to happen in the future, there are many lessons that we have learned from this, and many things that we have adjusted to. Dr. Charles has said as well that internationally, one of the ways of clearing somebody who tests positive is to test them again in 10 days, between 7 and 10 days, and to see if they are still positive, or if they test negative, to allow them to be released. But the other acceptable policy is if somebody tests positive, that they remain in isolation for 14 days. And after 14 days, and only after 14 days, whether they receive a test or not, are they able to come out of isolation. So if the system were ever to be overburdened again with respect to the number of persons who tested positive or contacts or so, one of the ways that's used elsewhere internationally is that individuals are kept in quarantine for 14 days, or in isolation for 14 days. With respect to those traveling that had to bear the brunt of this and the ripple effects of this cluster outbreak, yes, quite a few persons had to stay longer than was expected. Again, we understand their frustration, particularly due to the fact that it was around Christmas time as well. We have always said that we endeavor to, and persons will be tested on day 4, and that they should make reservations for a minimum of 7 days. And we work diligently to clear individuals within that time frame. But our quarantine document and our quarantine regulations that those very same individuals signed to says 14 days. We understand the reason for persons coming and the need or desire on their part to clear out of quarantine as early as possible. And therefore we endeavor as quickly as possible to get them cleared from their day 4 swab. But I cannot guarantee you that as we proceed in the future, if we were to have another cluster outbreak or so, that we would be able to maintain that 7-day. And it is unfair to expect the ministry to be held hard and fast on that at the expense of clearing individuals in our very own community. And priority was given to individuals in our very own community who had tested positive or who were at risk for direct exposure, as opposed to individuals who had traveled in. We need to be aware as well, while we welcome all of our brothers and sisters who return to Grenada, and anyone who chooses to visit us at this point in time for whatever reason, whether it is unfortunately for hardship because of a death in a family member, essential business, or to be home with friends and family, or to be in this lovely place that we call Grenada. Most countries, including Grenada, if not all countries, still say, please avoid non-essential travel, and that there are risks involved. We have seen as well, outside of our ability to test and release people from quarantine, we have seen individuals who have traveled to Grenada or had intentions of traveling to Grenada have the terrible inconvenience of not having flights come from the UK, not being able to travel from the UK. We've seen the UK themselves, in certain instances in recent history, stop all of their flights traveling out of the UK, and other countries doing similarly. We understand and identify with our brothers and sisters in Trinidad and Tobago who still don't have an open border because of the challenges that they are experiencing there. The common theme here is that international travel, or travel as a whole, is risky, extremely risky at this point in time. Risky from the point of view of infection, and risky from the point of view of being able to be held hard and fast to your plans or our plans for time-wise.
I will try and address the other two questions.
There was a question on schools.
Schools, yeah.
Yes. Specifically, yes, the Ministry of Education did make an announcement, and I want to clarify that announcement was for all schools and not necessarily for public or private schools in particular, all schools. But the situation, as Dr. Charles has alluded to, and I'm sure that's what he will give more information on, is constantly changing. And we will continue to communicate over the next couple of days and meet with the Ministry of Education, my counterpart minister as well, and make an evaluation as we proceed. But to date, as of this point, as of this press release, this press conference, I can say that there has been no change from the original announcement made by the Ministry of Education.
All right. I just wanted to add that, as I mentioned before, this cluster we're not yet finished, because there are still 9 active cases. These are persons who live in our communities, and the process of contact tracing and all of the other public health measures are still ongoing. We are aware that there are varying degrees of varying levels of compliance with some of the measures that we have recommended, particularly at this time of the year, which is normally the festive season. So, as a result of this, we are not out of the woods yet. We need to continue to be vigilant. We need to continue to enforce the measures in order to ensure that we arrive at a point when we are a little more confident that it is safe to have schools open, because as we know, schools are sites where there's congregation of large number of individuals. So the reopening of schools would depend heavily on the epidemiological situation at the time. In terms of the priority for vaccination, as you know, we have a small health workforce, and we need these individuals to be functional to address events such as these, a public health emergency. Hence the reason our frontline workers, particularly our health workforce, are initial targets for vaccination. And depending on the number of vaccines received, we will go frontline workers.
I didn't quite catch that. Could you please
Sorry.
repeat it?
Sorry. Right, so our frontline workforce, which includes our healthcare workers, our police, our workers at the ports, our wardens, our contact tracers. Then we have persons with underlying health conditions that put them at increased risk. We have other individuals such as the elderly, those over 65 or so. So all of these are our targets for vaccination. It depends on the number of doses that we initially receive, but of course, we must ensure that the core frontline staff who are responsible for keeping this outbreak that we have under control, they will be our initial targets for vaccination.
Thank you very much. So, colleagues, we are just about nearing that time to wrap up. So, as we promised, Callistra Faria, you have a minute, as well as Kellon Bob, and then we will wrap things up. So, Callistra, go right ahead.
Okay, thanks. Did the ministry ever have to track anyone who left quarantine because of the backlog that say we no longer have? Did we have to track anyone who left those quarantine sites without getting a test result, whatever the result was, negative or positive? Did we have to track anybody? I know that there were people who stayed up, for instance, in Captain Harris up to 11 days and then were told you can go without getting an official result from the ministry, written or by word of mouth. So did we have to track anybody after that? It happened at a number of hotels. And secondly, the investigation into the Sandals cluster situation. The minister did say that now we're having testing on the fourth day, which was a critical aspect of the corridor. Are we acknowledging that there was a design flaw in the corridor itself, or is the investigation indicating that there was a breach by or in Sandals? So was there a breach, or did the problem occur because of a design in the program? And are we making additional changes to, because of the nature of the corridor, to quarantine Grenadian workers who are within those hotels? I know one hotel was doing it, quarantining their workers, not letting them back into the community within a particular period. But are we now considering making that part of the design of the corridor? Thank you.
I'd let Dr. Charles comment on your statement of people being released without being tested. But before that, just to say that over the Christmas holiday period, individuals in the last couple of days have been charged and sentenced based on their breaching quarantine, yes. So yes, that happened. As to whether a person can use the excuse of a delay in their expected date of clearance from quarantine, no, the law does not allow them or permit them to do that. They are, and they would have signed to 14 days quarantine and to remain in quarantine until medically cleared. So that is why individuals were charged. To address the issue with respect to the hospitality corridor, there's been constant redesigning of, as I alluded to earlier, of any and all of the protocols with respect to coming to Grenada. As I said before, and I'll reiterate again, we did not have previously a pre-travel testing. Then we had a 7-day pre-travel testing. We moved that to a 72-hour pre-travel testing. We did not have the requirement that everyone who enters Grenada do a day 4 swabbing to be cleared, because there were individuals entering that did not want to leave their facility and only stay in their facility and then travel back out. That has been adjusted as well. As a result of this, that all individuals, whether in the travel corridor or not, will be tested at day 4 as we move forward. Flights from the UK currently restricted. There will be adjustments again as we learn more. Right now, we expect that this iteration of restrictions would remain in effect until the 11th of January. I do hope between now and then that we will be able to make an announcement. It is my hope, based on the information that we would receive between now and then, that flights can resume after the 11th. But that information and those facts are yet not available to us. But we can say that the travel restriction goes to the 11th. Individuals can begin making plans if they still have desire to come to Grenada after the 11th. And we will update as quickly as possible so that they can make those adjustments when necessary. This is also why the airlines, most if not all of the airlines, have a policy of no change fees and so for individuals who purchase tickets, because they recognize that not just travel to Grenada, but travel worldwide is a constantly changing target. Grenada is not the only country that has put travel restrictions. Many other countries have put travel restrictions for persons coming from the UK. So as information becomes available, we make adjustments in our protocols as well as in our restrictions or no restrictions wherever they exist, including our very own curfew travel restrictions here. And we are not alone in this. As I just said, Barbados has announced that they have some restrictions right now as a result of whatever information they have, and they have made that determination. We make our adjustments and fine-tuning and strengthening of our protocols as we, like everyone else in the world, learns more and more about this disease.
Yes, listen. Should
Go
I
ahead.
proceed?
Go ahead, Helen.
All right. So this is a follow-up to the question that Linda posed with respect to the vaccine rollout in Grenada, and I'm sure the minister can answer this. But Minister, I'm not sure if you are aware, but there is a major anti-vaccination mood in Grenada and in other Caribbean countries, quite frankly. Some for good reason, based on the problematic history of public health, the racial history of public health, and others based on conspiracy theorizing. In fact, I believe at a sermon delivered by Father Gerard Paul last week, he questioned the efficacy of vaccine protocols. Now, my question is, would there be any kind of public health messaging campaign to coincide with the distribution of the vaccines in Grenada to a population that is resistant to the idea of accepting the COVID-19 vaccination at this time? The second part of my question is this: what are the legal obligations with respect to immunizations and inoculations in the country? What happens, say, if a citizen decides that they will not want to accept the vaccine? What does that look like? So that's it for me.
Okay, thank you for that question. From day one, there have been two viruses spreading like wildfire throughout the world: the virus of COVID-19 and the virus of misinformation and disinformation. And both of those we need to get control of. Now, whoever made those statements needs to recognize that they were free and healthy to make those statements because they don't have measles, because they don't have polio, because they don't have smallpox, because they don't have rubella, because they don't have so many other viruses that they themselves received vaccinations for. And that is why they are around, and many of us are around, to make such statements, is because vaccinations work. There have been instances where individual countries or individual health officials have been unethical in their testing and dissemination and studying of certain diseases. That is separate and apart from the tremendous continued success that vaccinations have worldwide, including here in Grenada. The issue, as I said, is choosing the appropriate COVID-19 vaccine for us, without which, same way if we did not have a measles vaccine, we would have measles rampant. If we did not have a rubella vaccine, we would have rubella rampant. If we did not have a polio vaccine, we would have polio rampant throughout our society. So the disinformation virus, we need to get control of it. I think we need to speak to the science. I understand the anxiety of certain people of anything that is new, including a new vaccine, which is why we are waiting. And we are saying, as I said earlier, we are waiting for Pan American Health Organization, WHO, and I just introduced the possibility of us relying on the very same authorities that we have relied on for decades and beyond in terms of their opinions on the appropriate vaccine to consider. With respect to mandatory legal requirements, etc., we already see certain countries saying or implying that persons would not be able to travel to their country without a vaccine. And that is a significant possibility, and that is a norm with respect to, for instance, yellow fever vaccination and other vaccinations that have existed, that countries say, while it is not necessarily mandatory nationally for all countries, but in order to travel to a specific country, you must have XYZ vaccine to travel or to re-enter your own country having traveled to that country. That is a significant possibility that as to the way the vaccination regulations, if any, international regulations would play out. In terms of there being a law that it's mandatory for you to have that vaccine, I don't see that as a possibility. But in the same way with other vaccines that exist right now, government has the right to say that if you don't have a vaccine, then you do not have the right to put others at risk. We say right now that individuals who do not have the list of vaccines that we have as mandatory here in Grenada cannot enter our schools. So those are the types of things that we would say. I think it is essential that frontline healthcare workers, as the responsible employer, as the Ministry of Health, that we should ensure that they are vaccinated, and that I think the hospitality sector needs to consider and ensure that their employees as well are vaccinated, and that they should assist the government in the procurement of said vaccine, whichever one it is, in terms of helping to meet that cost as well, to vaccinate their frontline team to deal with individuals. I do expect, as we have seen elsewhere, a significant number of individuals, if not the majority of individuals, coming to their senses and accepting this vaccine the same way they accept any and all the other vaccines that keep us healthy right now. That is the discussion that we will have. That is the public discourse that we will have over the coming weeks and months. I do hope that it is weeks and not months, but it is the discussion that not just Grenada is having, but many other places. Countries that have yielded, or public health authorities that have yielded in the past to not maintaining a national vaccination program with respect to, for instance, measles, have seen a resurgence of that very disease in their own countries and regret that and have had to step back from that. So accepted vaccines need to be used as much as possible to help prevent the disease that they protect us from.
Very much, colleagues. Gentlemen, it's time for closing remarks. So I'll start with you, Dr. Charles, and then the Honorable Minister will have the final word.
Well, in closing, I would just once again like to recognize all our frontline team, our staff who worked diligently to assist in controlling the recent cluster. In particular, our community health nursing team, our staff at the lab that worked throughout the Christmas and Boxing Day weekend to ensure that that huge backlog of tests were processed, and which permitted persons who were in quarantine to leave in reasonable time. We do understand that there were some individuals had a difficult time, but our staff stayed up and they put in the work. They didn't spend Christmas with their families. They were in the lab and they were out there trying to ensure that we put in the work so that everyone is looked after. So we want to recognize them, the police, our wardens, contact tracers, the health desk, which we refer to as our engine room. I want to recognize all these individuals that are doing a tremendous amount of work in the background, and we do not see it. We would like to recognize them. As I end, I would just like to say that I have no intentions of engaging in any form of PR battle or PR engagement or anything of that sort, because I neither have the time nor the energy, because there simply is too much work to be done. I come here to present the facts as they are. I put no spin on it. All right. I just hope and I trust that the persons receiving these facts will see them for what they are, and will see the alternative facts for what they are. All right. I just want to ask everyone, as I always do, to continue to obey the public health measures that we have been recommending in order to keep this disease under control. It is a serious disease. All right, we have been doing a lot of work to ensure that we don't have the consequences that we see in other countries. All right, we're just asking for everyone's support as we continue the work to keep this country safe. Thank you.
Thank you, Dr. Charles. Minister?
Let me say that it has indeed been a trying year, a difficult year. But it is a year in which the Ministry of Health, the government and people of Grenada have been tested, and we have come out of this stronger and better out of this year. I really want to join and say, I cannot say it enough, the appreciation and recognition that our frontline team need to be given for the entire year's performance that they have and service that they have given to the Ministry of Health, to their country, and to the people of Grenada, and continue to, even as we speak now during this very press conference, they continue to, which is why it is unfortunate when they have named themselves with their big logo. It is unfortunate when Sandals makes statements like they did last night. And as Minister of Health, I feel it necessary to defend and stand up for my frontline team that continue to perform yeoman service, the science behind the protocols that they are following with respect to testing, swabbing, the efforts they continue to make to do this in a timely manner within the prescribed WHO and Pan American Health protocols and procedures. And I do believe it is better for any and all establishments to work with each and every one of the national authorities in any and all of the territories that there exist, and not to create an impression, and I'm sure that is not the impression they want to create to the public at large, that they have a certain level of impunity or that they are bigger and better than the Ministry of Health in Grenada, Ministry of Health in Barbados, or wherever else they may have come into conflict or loggerheads with or have an issue with. The ministries of health in each and every one of these countries are the authority with respect to testing, quarantine, protocols, and regulations of public health, including and in particular in this instance, COVID-19. And I look forward to every single one of us, private citizen, company, regional company, international company, that has the privilege and joy to be in Grenada or on any of our other Caribbean islands, to follow the rules and regulations, and most importantly, to respect the local authorities. So in closing, I also want to add that regrettably for us all, this is not going to be the kind of New Year's or Old Year's night that any of us would have liked to have had, particularly in saying goodbye to what has been a most difficult year for us all. It is the reality that we face. I want to wish everyone good health, strength as we leave 2020 and enter 2021. May we continue to be blessed, and may we also recognize some of us having greater challenges than the rest of us. In particular, also, I want to take time to recognize our brothers and sisters in St. Vincent, who on top of dealing with this COVID-19 outbreak worldwide, are dealing with the threat of their La Soufrière volcano. Our brothers and sisters in Barbados too, who are dealing with the announcements being made by their governments. Our brothers and sisters worldwide, Grenadians, non-Grenadians, all, who are dealing with COVID-19 and as a result of it are not celebrating in the way that they would choose to or want to, and regrettably for some of them are still remembering, marking and grieving the loss of a loved one. It has come at tremendous financial cost to us all as well, globally. And we do enter 2021, I think, with the desire, the intention, the strength and the perseverance that we will get past this as quickly as possible. This too shall pass. And we will look back at some point in 2021, hopefully, to say that this is behind us, and as a nation united, we look forward to the future outside of COVID-19. So again, Happy New Year. All the best to all of our brothers and sisters out there, far and wide. And finally, again, cannot be said enough. Thank you, thank you, and thank you to all of those who continue to work hard to keep us safe, including our very citizens who remain compliant in these difficult times. Thank you.
Thank you very much, Honourable Minister and Dr. Sean Charles. Colleagues, thank you so much as well. And before we end, let me just repeat this for you, just so that it's clear to everyone. Further to a press release issued on December 30, the Government of Grenada now advises that permission granted to designated facilities for fireworks displays on Old Year's night, that is tonight, has been rescinded. Therefore, there will be no fireworks displays at any location in the country. All individuals or business entities are therefore asked to be guided accordingly. Government apologizes for any confusion created by the previous release, but it encourages the cooperation of everyone. Failure to comply could result in legal consequences for breaching the current regulations. The Government of Grenada takes the opportunity to wish everyone a safe, healthy and productive 2021. So to all of you viewers on the Channel 22 or Facebook and YouTube pages, and of course our colleagues who joined us via Zoom, thank you so much for being with us. Happy New Year to everyone. Thank you.